So tab-cel, or the actual name for it is Tabelecleucel, but for it's difficult to say it. So for abbreviation, I'm just going to say tab-cel. But the way that you say it is Tabelecleucel. Tabelecleucel. So we'll call it tab-cel. We actually presented our updated outcome of a Phase III ALLELE study as a large multi-center Phase III global study using tab-cells in patients with EBV positive PTLD, post-allogeneic stem cell transplantation or solid organ transplantations failing Rituximab with or without chemotherapy. Around 75 patients, we're reporting an outcome of 75 patients here, 26 patients after allogeneic stem cell transplantation, 49 patients after solid organ transplantation. A little bit about tab-cel. So tab-cel is an off-the-shelf, non-genetically modified, allogeneic, EBV-specific immunotherapy that can eliminate EBV positive cells. And the way that eliminate the EBV positive target is still through T-cell receptor, MHC class 1, on the surface of basically infected cells, malignant cell, presenting EBV-associated antigen to the tab-cel through the natural pathway. Normal T cells from EBV positive normal donors are used to manufacture tab-cel. And because we need to have the tab-cel product needs to be matched to a restricted HLA of the patient, so you need to have multiple cell lines to cover the populations. The diverse group of donors are being used to manufacture a wide variety of basically tab-cel lines to cover with the goal of covering 90% of populations. So that's the tab-cel product. How we choose a product for the patient, you use a HLA from the recipient and a donor and a transplant, and based on those and a restricted HLA, you find the tab-cel line for the patients. 75 patients enrolled, 26 post-allo, 49 post-solid organ transplant. In terms of safety, was very safe. No death related to this was reported. In terms of adverse event of special interest, no cytokine release syndrome, no ICANS, no tumor flare, was 2 transient GVHD that were treated. In terms of graft failure, post-solid organ transplant, we had 3, that 2 of them were completely treated and reversed. In terms of efficacy, in the second line setting, these patients, as a standard of care, they don't have really good options. If you are primary refractory or relapse, most patients, they have median survival ranging from 1 to 4 months, and most patients die of this. So we saw overall response rate of close to 50%, with complete response rate close to 30%, and partial response close to 20%, with the median progression-free survival of close to 24 months, and 1-year estimated PFS close to 75%. Another important thing about overall survival, for responders, 1-year estimated overall survival was close to 80%. That is impressive for these patients. This product actually is already FDA already approved in Europe. It was approved in December of 2022 based on the preliminary result from the same study. Based on this updated larger cohort here, BLA is filed and under priority review the FDA with the PDUFA date of January 15, 2025.